congratulations on your presidency.
And congratulations on yours.
Thank you.
Just finished. Well done.
Thank you. So looking back, what was your most memorable experience serving as president?
There were quite a few memorable experiences. Actually, one was as president-elect, where we had a board meeting on 9/11, and being in New York, I don't know how I did it, but I was able to dial in on the call, and I wasn't really quite mentally there because we were all traumatized by the day, but I was committed to the ASDS and made the commitment regardless. But I think one of the memorable moments or events really were the board meetings that we had. We had such a dynamic board. We had so many important issues, and the board meetings would go on and on and on. But there was a lot to be said, and I think we accomplished a lot.
That's great. So in 2002, what were the main issues that were facing the society?
There were several main issues in 2002 that we had at that time. The ASDS as an independent organization was relatively new. While we existed as a society, we had just broken away from the AAD the year before and had our own independent management team. So in many ways, we were feeling our oats, getting the word out, and dealing with that as a primary issue. Other major issues that we had at that point in time were really the branding of the specialty, letting people know that we as dermatologic surgeons had some unique skills. We're being battled quite a bit by our plastic surgical colleagues who were trying to minimize our credibility, so this was a big concern for us. And we were also facing the development of new technology and the advent of fillers, where fillers and toxins were being integrated on a regular basis into the dermatologic surgeon's practice, which was still relatively new at the time.
Yeah, that's right when the hyaluronic acids came out.
That's correct.
All right. And what do you feel the most significant innovations in dermatology were at the time, which is?
Well, at that point in time, my perspective, based upon my particular interest, was in technology. And the whole concept of non-invasive rejuvenation was coming into play. Thermage had just come out, so there was a lot of interest in what one could do with non-invasive skin tightening. New fillers were coming out at that point in time. The hyaluronic acids were relatively new, had replaced collagen, which was the standard in years past. So people were feeling and finding out what they could really do. And Botox, which was the only botulinum toxin at the time, was also being integrated at a much higher level and much greater degree than we had seen in the past.
All that was ramping right up. And looking back over your career, do you have a most memorable patient or any patient story you want to share?
I have a few memorable patients, but one going back at least to this particular point in time was a young baby who came in with a large port wine stain on her face. And she came in at 3 days of age. And at that point, we were just beginning to work on the concept of early treatment in the office setting without anesthesia. So we used the pulse dye laser at 3 days of age, and really by the age of 2 months, after a few treatment sessions, we're essentially clear. So this, at least in my practice, began the concept of early intervention, taking the idea of the laser technology that we had and implementing it much earlier to get a more complete and faster response.
Yeah, and at that time, that was a radical idea. Did you get any pushback from other providers?
Tremendous amount of pushback. I still get it to this day. People don't understand how you can treat a child in the office setting. People don't think that it's necessarily safe to treat a child in the office setting, or at least at a young age without the risk of scarring. But we have found time and time again that we can do it safely and effectively.
Yeah, it's the most effective time. Let's see. Looking back at your career, is there anything you would change or do differently?
I have absolutely no regrets. I would do nothing differently. I began my career as an academic dermatologic surgeon at NYU, where I was head of the laser and skin surgery program there for 9 years after having done a fellowship there. And that gave me the solid base to build my career, the academic credentials, the ability to understand what it took to be a thought leader. And then I went out and built the Laser and Skin Surgery Center of New York, where I presently practice after that. So I think the combination of having both lives were very positive for me.
What advice would you give to today's young dermatologic surgeons?
We are in a fantastic specialty. We have a long menu of options and opportunities. Take advantage of them all. Continue to be aware of the changes in the field, become part of those changes, and recognize that this field is evolving so quickly that the changes that we are experiencing are so rapid that you really have to stay on top of it all to be the best possible physician that you can be.
Sound advice. What are your predictions for the future of the specialty?
The specialty will remain very, very strong. We have attracted the best possible minds to not only dermatology, but dermatologic surgery. So we're very fortunate that such tremendous people with great motivation and interest in what they do have come into our specialty. So I think we'll be strong from that regard. I think our leadership will be strong. The clinical care will be strong. I am concerned, however, about some of the political forces that are out there, in particular what's going on with the non-physician practice of dermatologic surgery. And what we're seeing in the spas and salons and non-MDs, non-dermatologists performing procedures that are really part of our domain concerns me. And it was a big issue when I was president in 2002. We worked very hard to get the word out at that point in time. And I think in many ways we failed because we've not been able to convince the public that we are the best at providing those particular types of services.
And what advice do you have for the ASDS leadership in serving its membership in the future?
ASDS leadership has done a fabulous job. Your year, Tom, as president was unbelievable in terms of expanding the scope of services provided to the members. I think continuing to educate is critical, for sure. Political involvement is absolutely essential. I think we need to continue to brand ourselves as the experts, no question about that, and continue to try to get legislation that will limit those who are trying to infringe upon what really is our space and our ability to provide the best possible services to patients.
Excellent. And that's it for these questions. I do want to do one off script, can we?
Sure.
So Roy, in your career, I mean, you have been an innovator and done things that have changed the way we practice medicine in our office. Of all the things that you've done, what are you most proud of?
I'm most proud of what we've done for the young children. I think the ability to treat some of the young babies early on with laser treatments with large malformations has been a life changer for many of the patients and their families. And if I were to look back at my career and think of one thing that stands out the most, I think it would be that.